But when you are in your own clinic, your own place, that all goes. And then as Prof. Islam explained, as aging comes along, as aging, that plus, I don't know, maybe a bit of COVID and all that apathy came in. So out of the blue, I just decided I sold my clinics. Very well-doing clinics, I just sold it out. I was just fed up. I didn't want to get involved with all that, And the TV became my best friend. Each time they come out with a bigger model, I replace and put a bigger TV, and I became a couch potato. So my kids, my wife is a doctor. I've got 3 other brothers who are doctors. 2 of my daughters are doctors. Again, I can tell you a family of doctors from different backgrounds. I've got a lot of friends who are doctors. Edwin is one of them. He's one of the trustable fellows. You can ask me, I can tell you who to trust, who not to trust. I've gone around. In my earlier days, as Carol here will tell you, they had all this testosterone replacement therapy. For guys or even for women. Women HRT, for us TRT. You want to feel boom, voila. Testosterone last time injectable, right? Then they came with the rubbing testosterone, the stuff that you, even for women. Either you put it there, you put it on your scrotum, But it gets on your clothes. Imagine washing those clothes, and your kids, your family, and all that are going to get affected by that testosterone that's left on the clothes. And all that gets into the mainstream. And I can tell you, no replacement therapy is like your own. You do the injectables, it gives you the boost. I think I got a record for the fastest bike ride up to Cameron. 2 days after putting a testosterone shot. Nothing mattered to me. Every corner I saw, reaching the top, I got the marks because the bike skidded and I had an accident. But I didn't care, I just got on the bike and went on again. That was due to testosterone. So after I realized, I stopped all that. And then I just sat around till I read one of Edwin's on this therapy over here. So just before going overseas, I think I tried to get a session. I couldn't, but after my return trip, I had to go up and see one of my wife's relatives who had cancer. I think he knows about it. But when I came back, I came for this therapy. And I can tell you, for the last 3 years, as a man, all men in the morning, they got early morning erection. At 4 o'clock, the crank up occurs. Women don't show the thing, but men definitely. If you got a husband, you see, if he's functioning well, early morning 4 o'clock, the crank up begins before he wakes up. The indicator will be there, the erection has to be there. That's the normal part. Why? Men, when you lose erections and you don't have it, it can either be your hormones are gone or your vessels are blocked. Better go and get yourself checked out, seriously. So anyway, I came for this one session, and Edwin, the guy is my best friend, put me through that machine, and the effect was of it, of course, you get a lot of these contractions and all that going on. But I tried the first machine the first time. It was not very painful. What it is, I went back. My wife just had gone to the US, and I was all alone, in my apartment here. And somewhere from 10 o'clock, 10 p.m., I think, until in the morning, I had a raging hard-on. Horrible, I tell you. It was like, what can I say? Like, not even in your teenage days, you can have something like that. I was seriously amazed. They had put 2 of the probes that they use for the vagina for men. They put it in between here. I mean, I talk to you like a doctor. I'm very open, even with my kids, everybody. We have to be like that. I don't know whether that was the cause, but wow. Yeah, it was the cause. See? So, then subsequently I did other 2, but I did with the older machine, thinking, the stronger contractions with more pain resulting on that would give me faster results. I want to be back to 30. I just signed up for 2 new clinics. I'm making them back in Ipoh again. Seriously. Yeah, I'm opening 2 new ones again, and I'm hoping to have 7 to 10. But I want to cater to I want to have 2 types. One type is to the B40, where I won't charge anything, 15, 20 ringgit, that's it, just for the common man. I want to have a wellness center. The wellness center, because I believe, be proactive, take a step for stability. Correct? You don't wait for the fire. You want to make sure the fire isn't there. Right? You don't want to have the heart attack. You have the heart attack, after that, then you can put how many stents there. You'll be worried. You'll be scared. That's for sure. So, apart from that, yesterday, I had another thing done. I've been quite well with my eyes so far. With all the bike rides, all that, I don't use all these spotlight lenses or this or that. I just think maybe some of us are naturally quite lucky, or maybe it's the good visors, I use the good helmets. I had dengue some years back. I was admitted here in KL because I got a brother in Grand Eagles, he's a surgeon over here. So whenever there's something, he calls me, make sure that I end up over here. So I was in Prince Court, and by the 8th day of suffering from it, I started peeing blood, You actually see, if you had dengue fever before, it's the worst, horrible thing. My daughter also had it. The daughter was as tall as this lovely lady, I think maybe a bit taller than her. So she's a doctor as well in London now. She was in the next room and I was in one room. She had got up and collapsed. I was being blood, and then next thing, I was looking out towards the Petronas building. I noticed this kind of like dirt on the glass. When I looked at the glass, the same thing. Then I realized I had a bleed in my eye. And that remained with me. So yesterday, you can show them the picture. Yeah. So they did this for me. Helios, 30 minutes, I think Prof did some 10 minutes, then she asked somebody else. But she did say the eyes would get better. And in the morning, you can see the difference, post one side done, one side not done. And these are 30 minutes, you don't, unlike the other machine, the DG machine, you don't feel a thing. I've had lasers in my clinic, I know they're going, she's not like angry. I have all sorts of lasers in my machines in Ipoh. Also HIFU. I think I was the first one to get a HIFU. Okay? I tried it on myself as well. Oh, good Lord, I don't know how women tolerate half the things that are done on them. Even the lasers are painful, And this one, you don't feel nothing. So I sort of what, but when they showed me the pictures, better look. In the morning when I got up, the skin was much better, And when I looked around, the thing was gone. One session.
Yeah.
And show me the next pictures.
With the ladies one,
Oh! This is my aim.
Make it jealous.
I've already booked it. Half a ton. I've already got a gold wing.
The dream is this one or this one?
This one. I love the lovely ladies. There's another one. I took my adopted daughter and all that because for a long time, my son, who's also there with me in Ipoh, he takes them around. That's what they didn't upload. But I took my two, they're already teenagers now, 15 years old, and they need these outdoor activities and all that. I didn't have the go, just the whole day, sit down, watch one. But this treatment, now is the 3rd session. Today, I'll go for my 4th session. It's giving me the difference. Take my word for it, pass the message along. I mean to say, okay, I can wait for an event, wait for a heart attack, and if I'm lucky to reach the hospital in time, get a $25,000 to $40,000 procedure, and I can just sit down and waste their life away. So for me, I believe in the quality of life. It's not just the quantity, it's the quality of life. While we live with this.
Yeah.
And the receipts? Yes, I paid to prove. Hey, one is missing. The first session cost me, can I tell them?
Yeah.
Okay, I had a special offer for doctors, $299. The try-on session. I paid for that as well. And I paid for this. And I'm not being paid to be here.
There's so many amazing testimonials that we have. We managed to just share one with you guys here. Right? So mostly you find that even the first session you find that amazing transformation. Now guys, I always ask people this. Everybody spends so much money on renovating their house. Right? No problem, right? Buy new cars, no problem. Right? Buying good clothes, going for an expensive holiday, no problem. When it comes to exercise, even okay, if you can do exercise every day, high intensive internet training, 4 times a week, okay, don't have to come to virtual gym. But I think very hard to do this. The most important thing about the virtual gym is it's an effortless exercise. You just have to lie down there and the machine exercise for you. Why? It's so important because at a certain age you cannot strain the heart and the joints. Right. Right. If that also, if it is so difficult not to come for the exercise, I only have one word for you guys. May God bless you with a good health. That's all I can say. See, over here, exercising 4 times a week, having good nutrition in your diet, what do you think? It's normal. People ask me, Doc, why you exercise like every day? And you eat healthily every day. I think this is what the normal people are doing. You are not normal, not me. You guys are not normal, not me, you can see. So, with that, I guess there's so much to talk about it. I would love you guys to join me because for the virtual sessions, we give a trial. We have a, before we end this, today we have a very special offer to people who get into the program today. We give it exciting. And stay back for some, what we have? Lucky draw. Yeah. Lucky draws to date me. I like to date with Dr. E. I'm just joking about guys, it's very privileged to have Professor Zanya here, I can see. I wanted to just simplify her things to quantum physics. It's not easy. It took me a long way. That's why I read every day and I write every day just to get more information for myself rather than everybody. To understand in a very simplified way. Of course, with the continuous guidance of Professor Zanya, I become a baby of quantum physics. Baby at 56. You see, look at it. MRI is a quantum physics. Laser is a quantum physics. Only that because of the development and the advancement of artificial intelligence nowadays, medicine will move into this direction because it's about accuracy, about hypothesis made into accuracy and made into reality to treat patients. I believe that many of you have, some of you have improved here so much after the exercise. Get into this when you feel that you are not capable of doing the exercise, you don't have the discipline to doing it. Or probably you have friends, you have heard about this today, right? Don't have to worry. Asking you to introduce friends to me, I know it's a major task. You won't want to do it. If you ever found anyone that needed this, just give me a text. What I do, I will send you something that you can just forward to them. You don't have to say anything. Right? I think this is the best way. Do not, otherwise, you maybe someone might thinking you are selling something again. Right? You must lose a friendship again here. Some Malaysians are very weird, you know. They buy everything but not from friends. Okay, guys, anything more that you want to talk? Alright. So we end this section. Okay, come guys.
I just want to add one more. This young lady over here, this young lady, Prof. Can I invite the ladies?
I'm older than you. Young lady.
I'm 70 years young. I just want to invite the ladies over here because this is what I'm aiming for. Just come and feel the abs. I'm not kidding. Seriously, I got a feeling, even if your husband goes to the gym regular, his tummy won't be like that. So I'll afford the one to the ladies if she allows the men. Wonderful. Okay? I had the feeling that's my main one. I'm going to take a picture and put it on my wall in my office. I'm going to make sure I want to be something like that. Seriously, come up and try it afterwards. Have a look. I'm not kidding. Seriously. check it out.
So if we're supposed to do it every day, do you sell the machine for home use? Or?
Yeah, sure. But you don't have to do it every day.
Yeah. Many people ask me about this after they heard about this business. Can I buy the machine? Sorry, you can't. I only list it to you guys because I need to control the quality of the results. You must to have a knowledge to do it. You cannot just like one washing machine and put it as something. No. You have a very deep understanding how the metrics and how we measure the patient because this matters to me. When patient is under my care, they have to be monitored closely. You see, to see them in what area I need to improve them and what area they are not so-called improving, what we're going to do about it. You see, being a doctor in longevity, not only I deal with virtual gym, I deal with almost the entire aspect of the health. Okay, Michael, you want to say something? No? Okay, Michael doesn't want to say something today. so what we do now, we end the session with what?
Light refreshment.
We end the light with a light refreshment. Oh, thank you everyone of you coming here. Lila will be a place that we continue to educate. Let's engage further, about this one because it's really a paradigm shift now for healthcare. Like Professor told me, please don't read the physics in the YouTube or in the book. Those are 19th centuries. We are dealing with 21 or 22nd century quantum physics right now, which is true. When I read that, all the theory is very bad. You see, do you know that quantum physics, so-called the quantum physics of one field Nobel Prize? Even with electron, can we say electron? They won a Nobel Prize. You understand that? What I mean that? Because it can be realized with the hypothesis. Thank you everyone for coming again.
So you recommend like twice a week or once a week, twice a week?
It can be twice a week, it can be every day.
She said no need to do everything.
Because it has no lactic acid, you don't need to diet it out, but because of the toxin.
She said that's not every day.
Huh?
Egg sandwich. I think this morning, so I have. Huh?